I didn't want to do engineering, that's why I did medicine. This chest pain could come from the nerve, from the skin, from the bone, from the food pipe, from the heart, from the lung. It could be psychological.
An alter ego called Dr. Homo Shapien. What's the goal of it?
And Dr. Homo Shapien's goal is to make this possible. Archimedes got his eureka moment in the bathtub. This didn't happen in the bathtub.
Many doctors can't even give like 2 minutes of time for each patient.
No matter how good a doctor you are, it's not enough. Lifestyle diseases kill 70% of the urban population right now.
What advice would you give people on assessing their kidney health?
Any change in the urine output, swelling in the feet or the face, your BP is because of the kidney. The heart is the victim of blood pressure. These three whites are dangerous: salt, sugar and rice.
Is there something wrong with their kidneys?
If you have blood pressure, you're going to either have a stroke or you're going to have kidney failure, your eyes are going to go, or you might die. Hi, I'm Dr. Ravi Andrews. On this occasion of World Kidney Day, I invite you to tune in to my insightful podcast on Bizz Buzz today. Join us as we discuss how to keep kidney diseases at bay, common myths as we bust them on kidney health, and also learn about who Dr. Homo Shapien is and what he can do for you.
Hello, Dr. Ravi. It's an absolute pleasure having you with us today on the Bizz Buzz show. So, can you tell us about your journey into nephrology and what inspired you to focus on kidney health?
Thank you very much for having me on the show. It's a real pleasure and honor. It's a long story, and every journey has a beginning.
Absolutely.
So my journey began in 1982 when I finished my 10th standard. So that was the Generation X, that sandwich between the baby boomers and Generation Y or the millennials. And at that time, after the 10th, you had only three options to do your 11th and 12th. Either you do science, or you do arts, or you do commerce.
Commerce, yeah.
So I decided to do science. And after the 12th, again, you have only two options, either engineering or medicine. That's if you wanted to go the conventional way of education. So I decided, most people decide to do medicine because they don't like physics and maths. So they don't want to do engineering. That's why they do medicine. For me, I liked biology, but I was very good in physics and maths, but I didn't want to do engineering. That's why I did medicine. The reason I didn't want to do engineering is because I was a little weak in maths and physics in my younger days, and my father used to teach me. He was a very good teacher. God bless his soul, he's not here with us anymore. He was a very good teacher, but he was extremely impatient. And I knew that if I got into engineering, he would start teaching me maths and physics, and then he would make my life hell. So I decided I'll go into something which he doesn't know anything about, which was biology. So I got into medicine. Once you're into medicine, after the MBBS, the 4.5 plus 1 year course that you complete, again, the options are, if you want to go into clinical medicine, the options are either you go into MD, internal medicine, MS general surgery, pediatrics, or obstetrics and gynecology. I liked surgery, but because of my excessive physical activity, playing games and all that during my MBBS career, I messed up my back, so I couldn't stand for long hours. So doing surgery, standing for long hours was a no-no for me. The other thing was I was a lefty. Now, in those days, all surgery was geared towards right-handers, not left-handers. The instruments and all were geared towards the right-hander.
Oh.
So it was very difficult for me to do surgery with my left hand. The second thing is, your assistant stands, you're supposed to stand on the right side of the patient, the assistant stands on the opposite side, and the scrub nurse stands on your right. So she'll be handing you the instruments from there. It's ideally you should be able to take it with the right hand, but I have to take it with my left. So that was very complicated. So with all these reasons, I decided I might as well go into internal medicine. I like medicine as well. Once you're in medicine, the program, it's a 3-year program. You have to rotate through different subspecialties. So you do 3 months of nephrology, 3 months of cardiology, 3 months of gastroenterology. And every subspecialty that I went through, I wanted to do it at the end of it. So I first started with gastro, 3 months. At the end of that, I wanted to do gastro. Then I did cardio. I wanted to do cardio at the end of that. My nephrology posting happened to be the last one. And at that time, all the other residents who were my colleagues, they had very negative impression about nephrology. They said it's very labor intensive. It is a lot of maths and physics in it, not much biology. There's not much clinical stuff in nephrology. So I was already, deciding I'm not going to do nephrology. I joined the department anyway. That was my last posting. And I spoke to my boss. His name is Dr. Bharat. He's still my philosopher, guide, mentor. And I told him straight away, sir, I don't think this is for me. I'm just going through the posting, but I don't think I'll do nephrology in the future. He says, Ravi, just wait. You join me. Let's see how it is. You enjoy, and then we'll see. Then you finally decide. So I joined the posting, and there I found that it is very, very mathematical, very lot of physical principles in it. For example, nephrology is about the chemical imbalances in the body. So you can decide what the value of the chemicals are. You give the treatment, which is physics based. So we're talking about solute removals, removal of fluid, the gap between the semi-permeable membrane, the concentration gradients. These are all physical principles. So you apply the physical principles, you do the treatment, and tomorrow you test, and lo and behold, you can predict what the value is going to be. So that was maths and physics. So I really liked that. It was so 1 + 1 = 2, like mathematical. The other thing is nephrology is absolutely clear cut, is crystal clear. I'll give you an example. Say you have chest pain. This chest pain could come from the nerve.
Yeah.
It could come from the skin. It could come from the bone. It could come from the food pipe. It could come from the heart. It could come from the lung. It could be psychological. So somebody with chest pain, you will do all sorts of investigations and you might still not know exactly what the problem is. Whereas in nephrology, it's very clear. You do a serum creatinine, the value is high, you know straight away this is a kidney problem. You do a urine test, there's some abnormality there, it's a kidney problem. You do an ultrasound, abnormal, kidney problem. So it's very clear cut, and these are all very easy basic tests which can be done almost at the bedside. Any lab would have it anywhere in the country. Also in nephrology, you have the full gamut of treatment. So you have the facility to do a biopsy. You have 2 kidneys. So even if something goes wrong during the biopsy and there's bleeding, you have the other kidney to back up. So you can make a quick diagnosis that this is a kidney problem. You can do a biopsy to confirm the root cause of the kidney problem. After you do the biopsy, if there's a requirement, you do dialysis. You can keep patient going for 10 to 15 years on dialysis. And if dialysis is not something which the patient wants or wants a next step of treatment, you do transplant. So you can completely cure the problem. And this is there only in nephrology. So to make a short story long, this is why I got into nephrology, and I have absolutely no regrets about it.
That's so interesting to hear because, in terms of a layman, I mean, it's all about treating the kidneys, but the aspect that you have told about physics and maths, I think it's something new for me and the audience as well. So thank you so much for giving this information, and your journey is very inspiring. So you have a very interesting name, an alter ego called Dr. Homo Shapien. So what's the concept behind it and what's the goal of it?
So I practiced a lot of cutting edge clinical medicine. I still do it, but I feel there's something missing. Because as a clinician, you're very tunnel visioned and you're more reactive than proactive. So, for example, somebody comes with diabetes. Your focus is only on giving either pills or insulin and controlling the diabetes. You don't look at a holistic perspective. Holistic perspective, you would have to also look at the risk factors, make sure the diet is appropriate, make sure he exercises regularly. If you can do some genetic manipulations, because diabetes is genetically predetermined with an environmental trigger. So you can do something with the environmental triggers, but can you do something about the genes and manipulate that? That also is possible in today's world. Plus, you need to look at their mental well-being, you need to look at their physical well-being, their happiness, all these things. If you expect the clinician to do it, he's not going to be able to do it. For a person to get this well-rounded, holistic well-being, say in a diabetic patient, you will require a whole group of people. You will require a dietitian, you will require a physiotherapist, you will require a gym expert, you will require a diabetic specialist, a physician, you will require somebody to psychologically counsel him. So the idea of Dr. Homo Shapien is to be the one person who wears all these hats and be the one-stop solution for this person to have a holistic well-being with his health. Now, as a doctor and a clinician, I realized that I was one person who could wear all these hats because I know the medical bit, I know about diet. Nephrology has got a lot about diet in it. I can do physiotherapy. I've been working out for a very long time, so I can give gym
Tips on that
tips as well.
Yeah.
In fact, I've probably forgotten more about gym and gym tips than most gym trainers would have learnt in their lifetime. So the idea of Homo Shapien was to be this one-stop solution and make people understand that they need to have this whole thing and evolve. It's not just about getting well and living your life. It's about living your life happy, long, fulfilled, and ticking all the boxes that you have in your mind. And Dr. Homo Shapien's goal is to make this possible and help people to do this.
That's very interesting. But in day-to-day life, we see that doctors are very busy, and few of them don't even give 2 minutes to their patients because they have like a huge line of patients. So, in spite of your busy schedule, how do you manage to do it?
Before that, let me just tell you about how I came upon this name, because that's interesting. Because that is one of the questions. Then we'll come back to this one. I'm sorry I missed that out.
Yeah.
So, legend has it that Archimedes got his eureka moment in the bathtub.
Yes. Yeah.
This didn't happen in the bathtub, but still, this happened when I was shaving. Now,
Okay.
while shaving and while gymming, I get these brainstorming ideas for whatever reason. Maybe because I'm doing something physically, but my mind is somewhere else. So I'm thinking. So I was shaving, and then I was thinking, I want to do something to improve Homo sapiens, to make them evolve, get them into shape. So I'm thinking Homo sapien, what to do? Homo Shapien.
Yeah.
So you're talking about evolution, Homo sapiens, and getting into shape as well.
Mm-hmm.
And then I'm a doctor. So instead of calling myself just Homo Shapien or Mr. Homo Shapien, I said, why not call myself Dr. Homo Shapien? So that'll say I can do the medical bit and I can do the shaping bit as well. So that's how the name came
That's
about.
very interesting to hear. Yeah.
Can I hear that question again, the second question?
No, what I was saying was, generally doctors are very busy. So you have a very long, huge patient list to cover. So many doctors can't even give like 2 minutes of time for each patient because, they have like targets to reach or goals to cover whatsoever. So in you being so busy, how do you manage to give this holistic approach?
So I don't buy this thing about doctors having only 2 minutes to spare for a patient. It's not enough. No matter how good a doctor you are, you cannot assess a patient and understand his problem and counsel him and write out the treatment in 2 minutes. So what I do is I limit my appointments. I don't just see 30, 40 patients a day. I limit it to 10 or 15 per day, and I give complete concentration to them. I spend at least 15 minutes with each patient. So if that is structured, then I find time to do other things. Now I believe when I get out of bed, my day has got 23 hours, not 24.
Oh.
The minute I get out of bed thinking I have only 23 hours, that 1 hour is for myself, for exercise.
Okay.
Only then it's going to happen. If you get out of bed thinking you have 24 hours, then you will somehow mess up on that. Yeah. The other thing I do is, everything I do, it's with a regimental precision. So I do everything at the same time every day. So discipline, wake up in the morning at one particular time, breakfast at one time, rest, get to the hospital at some time, try and fix the appointment in such a way that it's all done at one time. If you do everything at the same time every day, you'll slowly be able to shave off a few seconds here and there. If you're doing everything repetitively, you can do it faster. We all know that. Anything that keeps being done repetitively happens faster. So you save 1 minute here, 1 minute there, and at the end of the day, you can have your 1 hour for yourself, which I think is crucial for your overall well-being. So this is how I do it. And I can't buy that people are too busy. You can't be busy for yourself. You have to find time for yourself, and you can't spread yourself thin and see 50 patients and not see any of them properly. Mm-hmm. So if anybody wants my advice, if you want to go to a particular doctor, most people look at the crowd outside. Correct?
Yeah.
They see if there are a lot of people outside, oh, this guy must be very good, we'll go to him. Yeah. If there's nobody outside, no, he's no good, we don't go. What I would suggest is go to the middle guy. Mm-hmm. The guy who's got maybe 10-15 patients waiting. Not the guy who's waiting has got 50 patients. One, it'll take you a lot of time, and he's not going to give you time. Those who have no patients, likely to be younger people who don't have that much experience. Not that I'm panning younger doctors. I mean, it's always all a learning curve. And definitely as you do more and more, you get more experience and you get better at what you do. So you should go for the guy, the middle rung guy, who has enough experience, has enough patients, but not too many, and he can give you time.
Yeah. I think that's a very good advice because, as you said, we go by the crowd, and also, because I say it of personal experience, because when we try to book the appointment of a few doctors, it's like, the slot itself is for 2-3 minutes. So like 4 to 4:05, 4:05 to 4:10, I've seen. So like you said, you're giving like ample time for each patient. That's really comforting to hear in this era, especially. And, the name that you have come up with, and also the 1 hour mantra, it's very inspiring. I think we'll try to follow from now on.
If I can convince one person to do it, then this podcast is worth it.
Definitely. I think I'll follow it first and maybe our audience also will do it. And sir, coming to the next question, that we all know the concept of work-life balance. I mean, we have heard it in corporates, everywhere we hear this. But you have come up with a new concept called work-life health balance. So can you explain it?
Yeah. When people talk about work-life balance, they talk about it as it's a straight line with work at one end and your personal life at the other end. Now, geometrically, a straight line will never balance. It cannot balance because it will keep moving this way, that way, based on the weightage you put on each side. The only way to make this balance is to convert it into a four-sided figure. So the straight line should be converted into a four-sided figure. How do we do that? You keep your work and your personal life as the side pillars. You keep your medical health as a strong base. Remember, if your health is not good, you will never have a work-life balance. And by health, I'm talking about medical health.
Yeah.
And we'll come to medical health later. The fourth layer, the top layer, is exercise and diet. Diet and exercise are complementary. You can never outrun a bad diet. So you have to have exercise as well and diet as well. And exercise, like I said, should be 1 hour. Your day should have only 23 hours. And about exercise will come later. But let me talk about this medical health. Now, by medical health, I'm talking about lifestyle diseases like diabetes, blood pressure, heart disease, strokes, obesity. Lifestyle diseases kill 70% of the urban population right now. 70% of deaths are because of lifestyle diseases. That's scary. But the beauty about lifestyle diseases is they're very easily controllable by a few medications and lifestyle changes. By lifestyle changes, I'm talking about diet, exercise, good rest, sleep, reducing the stress in your life, avoiding unnecessary medications, those kind of things. So this is the four-sided figure that I'm talking about: work, life, health balance. So medical health as your strong base, keep that going, and exercise at the top. So this four-sided figure will give you a complete, proper work-life health balance. There's no such thing as a work-life balance because a straight line will never balance.
This is very good to hear, sir. But you see, everybody is very busy these days, caught up. Like, for example, the time we wake up, we have to like get ready and get people at the home ready, rush to office. There's like a lot of traffic, 1.5 hours, 2 hours we spend in traffic. So, like, many people, which includes me, we don't find time for, exercising on a day-to-day basis. So, coming to a real life scenario, how do you think people can work this out?
Okay, I have created, Dr. Homo Shapien has created a time matrix.
Okay.
It's something loosely based on the Eisenhower time matrix. So this Homo Shapien time matrix is a grid where we divide your things, and this is only about your this is about personal life. Work and all is not part of the grid. Exercise is not part of the grid.
It's only
So it's all about your personal life, how you adjust your personal life to find that 1 hour for exercise.
okay.
So you will divide it into 4 grids. One of them is things that make you happy, things that do not make you happy, things that you can give up on, things you cannot give up on. These 4 things should be, you make a list and keep that in your vision. Things that make you happy and you cannot give up on. Say, for example, reading. You like reading, it makes you happy, you don't want to give up on it. So you put it in, you do it. You put it in that grid where you say, I will do. And how will you do? You will either while eating, if there's nobody else around you, you can't, or just before sleeping. So you find some time to do that makes you happy, and also will you cannot give up on it. There are certain things which make you happy and you can give up on it. But if they make you happy, why should you give up on it? Let me give you an example. Somebody who likes to play cricket with the buddies. You like it, it makes you happy. You don't have to, you cannot do it every day. Do it on
Weekends.
Find a time, and weekends less work. So you will find time to do it. So do it with your buddies on weekends. There are certain things which do not make you happy and you cannot give up on. Like, say you have to go for a family function, and you obviously you have to go, right? It's your relatives, you have to go. So either you try to like it, or you try and fix it so it's on a weekend, or you delegate somebody to do it. For example, it's from your wife's side, the family function, you send your wife to do it. So that's how you can figure out things which you don't like to do, which don't make you happy, but you cannot avoid. And the final quadrant in the grid, things that do not make you happy and which you can give up on. Social media. We're all on so many WhatsApp groups, and many a time we never even look at them We just see some messages and sometimes we go into them and then that thread
We get caught up.
and we get caught up in it. Exit those groups or don't even look at them. Let them just pile up. Other thing is these apps, unnecessary apps on your phone.
Instagram is very addictive.
Instagram, yeah, it's very
Yeah.
addictive. So try and minimize the time on it. I'm not telling you to completely stop it. Other things, sometimes we start surfing the net. We go to YouTube, we see one particular video, that leads us to another one, and we just go on and on into that loop. It's very easy to break that loop. So most of the time, it's social media that takes a lot of our time. So if you can, I do WhatsApp mainly for medical reasons. So I keep answering my patients their queries on WhatsApp. Even though I'm trying to cut down, I still spend 1.5 2 hours on WhatsApp. If I can cut it down further, then I'll get 30 minutes there.
Yeah.
30 minutes at least you can save. Plus another 10 15 minutes here and there, you will get your 60 minutes in your day. It's just about being focused and being very strict. Okay, I am not going to deal with these groups. I'm not going to go into further videos. I'm just going to cut it short there. That's how you can do it. And unless you put into practice, it's not going to happen.
Absolutely. That's what I was about to say, because, we can prepare this grid, as you said, but I think, like you said, maintaining absolute discipline and getting into the track is the key for, scheduling all this, because like you said, we can write down and cut down on everything, but day-to-day discipline is very important for us to follow. I think we'll definitely try to do it. And sir, on the occasion of World Kidney Day 2025, so what advice would you give people on assessing their kidney health?
So the theme for World Kidney Day this year is are your kidneys okay? Detect early and protect kidney health. So this is the theme. So it's about early detection. Now, early detection and protection, if you ask me, starts at home, not in the hospital. You have to start doing it at your level at home. The thing with kidney disease is it's very subtle. By the time you get the overt symptoms, it's already well established and there is no coming back. There is no reversibility. There are very, very fine signs and subtle signs which you can pick up early on. These would be any change in the urine output. So if you're passing either less urine or more urine, it's not just about less, even if you're passing more urine, and the quantification is less than 500 ml per day or more than 3000 ml per day. If any of these things happen, you're likely to have a kidney problem. Then also the appearance of the urine. For example, if it's very dark or it's frothy, then there is likely, and it sticks to the pan when you pass, to the pot, sorry, then there's likely hold of you having a kidney problem. Swelling in the feet or the face are suggestive of kidney problems, though there are other reasons as well, but this is one of them. Also, your appetite. If you find that your appetite is going down, your taste buds are not as good as before, this is a possibility. If you're having persistent headaches and your consciousness is clouded, another possibility of being a kidney disease. Your blood pressure. If your blood pressure is high, it's likely that you have a kidney disease. Remember, and this is research which has been going on for quite some time and it's well established now, the kidney is the seat of blood pressure. Your BP is because of the kidney. The heart is the victim of blood pressure.
Oh, that is something new.
Yeah, most people don't know that. And many medical people also not aware of that. So the kidney is the seat. Whatever type of blood pressure there, it's the kidney that's responsible for it and the heart which is the victim of it.
Oh.
So the cardiologist and the kidney specialist need to work together on this.
Also, so you're saying that, even younger generation these days, they're getting BP since the age of 29, 30, in their early 30s. So they have, is there something wrong with their kidneys?
Yeah. Before we go to that question, let me complete the answer about assessment, self-assessment. So once you know the basic signs of kidney disease, you should assess yourself. So when you get up in the morning, check if your face is swollen, your feet are swollen. Look at the urine, see whether it's frothy, the color, the consistency, the appearance. Check your BP if possible, if you're having headaches. And all these things will help you to say that there is a possibility that you have a kidney disease and you can confirm it. There are tests, that simple 3 basic tests I already alluded to, that you can do to check it and confirm your kidney problem. Creatinine, complete urine examination, and an ultrasound. Can we come back to the next question that you asked me?
What I'm saying is, even the younger generation, they're getting affected by BP these days in their early 30s. So as you have said, kidney is the seat of it. So do you think it's something related to the kidney health? Even for the younger generation?
Blood pressure is of 2 types. I'll pontificate a little bit and be technical. One is no known cause. The other is secondary. That means there's a cause somewhere. Secondary hypertension or secondary blood pressure can be cured if you can detect the cause. Cured. Primary or no cause detected hypertension cannot be cured, it can only be controlled. Those are below the age of 40, there's a high likelihood, there's at least a 50% chance that they have secondary blood pressure. So it could be some hormonal problem, it could be some medications, it could be a kidney problem. So all these things you will have to detect, investigate, and if possible, treat. But there is still 50% who have no cause detected. So that is how it is. A lot of it is genetic. Some of it will be an environmental trigger. And the most important environmental trigger for blood pressure, apart from stress, the most important is salt intake. Salt. And it's been proven clearly over the centuries that salt is the cause for high blood pressure. And there's a very, very small mistake or error in the kidney which doesn't excrete the salt, which you cannot find out through blood tests or anything. It's just a very minor error, just that little thing, that salt is not being treated properly. That's why the blood pressure goes up. So you take more salt, your kidney is not able to excrete the sodium appropriately, your blood pressure goes up. So that could be whether you are young or old or whatever. The only solution is to limit salt intake. We take much more salt than we require. When we're born, we don't require salt. It's an acquired taste. And you know how salt came in? It is a preservative. During trade in the olden days, when people wanted to transport food items from one place to another, they didn't want it to get bad, so they would put salt in it.
Those crystal salt. Yeah.
That's why the worth your weight in gold, it's worth his salt. That's how the thing came up. Because you know, if you had more salt, you had more money because you could trade more. So this is the most important thing, and this is something we should do at a community level, to tell people you should not have salt. At a school level, reduce the salt, reduce junk food. Tell McDonald's to reduce the salt. There's way too much salt in McDonald's fries.
Yeah.
And any junk food, there's way too much salt. And this is what is creating all the problem. More than 40% of people are hypertensive. Why? Because of the trigger, the salt.
But I think once our taste buds are used to it, there's no going back.
No, there is going back. Once you reduce the salt intake, you will find that if you add even a little bit of salt, you won't be able to eat it.
Okay.
I've experienced it myself. I mean, I used to have salt normally. Then I got high blood pressure. I cut down on my salt. Now, yeah, I mean, I reduced it. You can't cut down completely. So I reduced it to a significant amount. Now, if my chef puts in even a little more of salt, I can't eat it. So whatever is acquired can get unacquired.
Yeah. So body will get used to it eventually.
Your taste buds and your body will get used to it. And it's good for you. Less salt, less fluid retention, less obesity, less blood pressure, so many things, so many advantages.
So many advantages, yeah.
And let's not even talk about sugar, or we'll talk about sugar later.
Yeah, that's one more thing.
These three whites are dangerous. The three whites: salt, sugar, and rice.
Rice. Okay, I thought maida. It's rice. Okay.
Rice is more dangerous.
Okay. And so, like, everybody's speaking about preventive health these days. Especially, I think this concept has come from abroad and it's taking shape in India also. So, I mean, rather than, like you said, getting detected, delays in getting detected, preventive medicine is something everybody's concentrating on. So, how does this work in nephrology?
I love that question. Now, the prevention of any disease, it'll surprise you, has 5 levels.
Okay.
Stage 1 is to prevent the risk factors. The risk factors itself you prevent. Now, the risk factor in kidney disease, or let's take blood pressure as a prototype disease. The risk factor in blood pressure, like I said, is salt. So you prevent the risk factor. How do you prevent it? By education. You tell people that salt is not good for you. You have these big programs. You tell them, you keep on drumming into them. Salt is not good. Reduce it. Reduce it. Reduce it. Educate the MNCs, educate McDonald's or whatever. I keep saying McDonald's, but there are a lot of others, the KFC, there are a lot of other people also who are putting a lot of salt. Educate them. If possible, legislate it. Salt is almost as bad as smoking.
Is it?
Yes.
Oh.
Yeah, it's almost as bad. In fact, if you ask me, and you don't even need to ask me, more people die of high blood pressure rather than smoking. More people, because it's so much more prevalent. So try to do some legislation. I know these are out of the box and radical thoughts, but unless we think about it, it's never going to happen. So legislate. So reduce the salt intake, reduce the stress. So tell people, educate them how you can reduce your stress levels. All these will help reduce the risk factors of high blood pressure, risk factors of disease. Stage 2 or level 2 is when you control the blood pressure with applying these risk factor limitations. So you tell the person, eat less salt. Till now, you're telling the people, the general public, to eat, and telling the government to do something about. So that's the first level. The second level is to tell the patient himself, you're going to get, you're likely to have blood pressure if you take more salt, so reduce the salt. The third level will be once the disease has already started, to control it. So your first level went off, second level went off, they took salt, the blood pressure went up. Then you give pills to control the BP. And of course, all the other lifestyle modifications, all that will go on. But the main thing here for in stage 3 or stage 3 prevention is to give pills. The fourth stage is preventing death and disability. So if you have blood pressure, if you don't treat it properly with pills and dietary and lifestyle modifications, you're going to either have a stroke, or you're going to have kidney failure, your eyes are going to go, or you might die. So you'll have heart disease. So these are, you prevent this by controlling the blood pressure with pills and giving them education about all these things can happen. And say, for example, somebody gets onto dialysis, gets a very severe kidney dysfunction, then you go to the next level by doing dialysis. So that is prevention of death and disability. Somebody has a heart attack, you put a stent. So that's the fourth level of prevention. And the fifth level of prevention is what's important and interesting. Avoid overdiagnosis and overtreatment. And this has to be educated to the doctors, not to the general public. Educate the doctors ki in blood pressure, don't do unnecessary investigations, don't give unnecessary treatment, because the treatment itself can worsen things. So these are the 5 levels of prevention, and this is what should be practiced. First, prevent the risk factors. 2, control the risk factors. 3, control the disease. 4, control the complications of the disease with dialysis or stent or whatever. And 5, control the doctors and make sure that they don't do over investigation and over treatment. So this is the steps of prevention of any disease.
I think this is really very educating, sir. And I think a lot of people who are very well educated also have this one basic doubt. We all as a layman know that, 120/80 is normal blood pressure. So what range can people start taking medicine, or generally it's being prescribed to everybody these days, ऐसे ही ले लो, I mean, it will be under control. So what do you think is the value that should really make us concerned?
This is the $1 million question. Now, there's something called the Joint National Committee, which meets every 3 or 4 years, and they formulate BP targets for people for different age groups. Till now, 7 JNCs have come. They gave up on the 8th because there's no consensus.
Okay.
Because each patient is different and the age groups are different and their primary disease is different. So you cannot have one fixed formula of BP control for everybody. But the overall consensus, taking all these JNCs into criteria, is 140/90 is considered high BP.
High BP, okay.
And there are again stages. More than 160/100 is very high, and more than 180/110 is like emergency or urgency. But the general consensus is 140/90. But again, you have to take the age into this thing into consideration. For example, if somebody is 60 plus, he might have a BP of 150/70. That is also acceptable for him. We also go by symptomatology. Suppose somebody is comfortable at 140, then we're not too worried about it. But if he is with 140 is having headaches and all, then you need to address it more. Then there are certain compelling indications for controlling blood pressure. For example, somebody's got kidney disease and losing protein in the urine. In this situation, you want the BP to be below 130/80, because high BP can push more protein and that can cause more kidney damage. So it's basically the age group and the primary disease and the symptoms of the patient which finally decide what blood pressure you want to keep them on. For example, people with this proteinuria in the through the kidneys, sometimes even go down to 100/70. And until the patient feels giddy, we keep on reducing the blood pressure. So these are all based on the patient and his response to the treatment. And there are also 7 or 8 different drugs. So which one you decide also depends on the primary disease.
So is low BP dangerous as well, or?
Yes, because you need blood pressure to drive blood to all the organs. So if the blood pressure is very low, this is termed shock. So in a shock state, all organs get less supply, all organs fail. And this is something called multi-organ dysfunction. It's a very, very dangerous thing and people can die of shock. So low blood pressure is also important. And low blood pressure happens either if you take too many pills, or you have some disease, or you don't take enough fluids. Dehydration can lead to low blood pressure, or you're losing blood somewhere. There are a lot of reasons for low blood pressure.
So the general advice would be, taking proper water or liquid input on a general basis.
Definitely. And I know what the next question is going to be. How much fluid should be given?
Yeah.
Correct? Yeah. Now, this is a very, very controversial subject. And most people say you have to drink tons and tons of water to keep your kidneys going. People drink 8, 9, 10 liters.
10 liters, 8 liters is what?
Exactly.
They have these Stanley cups.
Yes. No, it shouldn't be done for a lot of reasons. One, your body is smart. It knows how much water you need. It will tell you. So if you're dehydrated, your tongue will be dry, you'll be uncomfortable, your skin will be dry, you will know. You will drink water. Now, the general recommendation is 2 to 3 liters of fluids per day. I'm not talking about just water. So, all liquids combined, 2 to 3 liters. If you're somebody who works in the sun and sweats a lot, maybe you can increase it by another 500 ml per day. So, this thing about 7 or 8 liters, what happens if you drink so much liquids? It's got to come out, right? How is it going to come out? Through the kidney. And the kidney is working overtime. It's like you sitting here 24 hours and doing your work because there's so much workload on you. So you drink 3, 4, 8, 9 liters, the kidney has to excrete all this, so it's working overtime. The other problem with drinking too much fluid is it dilutes the essential chemicals in the body. The essential chemical mostly is sodium. So if you drink too much water, your sodium levels will drop. If your sodium levels drop, you can even die. It's that bad. And we all heard of Bruce Lee, that martial arts legend. Now, we all know that he died because of swelling in the brain. That is, and there's a lot of conspiracy theories about somebody poisoned him and all. But people, some scientists and doctors went back to the past and went through all the records and all. And Bruce Lee was an advocate of drinking lots of water. And they found that most likely he used to drink so much water. Because of drinking so much water, his sodium levels dropped, diluted. Because the sodium levels dropped, he had swelling in the brain. That's what low sodium levels do, swelling in the brain, and he died. So, nothing could kill Bruce Lee, but water did. So, drinking too much water is a no-no. Drinking too less also is a no-no. If you drink too less, yes, optimal is 2 to 3 liters per day.
I think that's very informative, sir. And when we talk about kidneys, there's a lot of fuss around kidney stones, because I myself have heard a lot of, people in the family or friends, because they're very confused, because, a few doctors, they say that, no, this can be cured by medicines. A few doctors say, no, the size is too large, it cannot be cured. And some homeopathy doctors say that, no, it can be cured without going. So there's a lot of, contradictory statements also saying that some doctors are just operating for the sake of it and it is not required. So there's a lot of fuss around it. So we would be grateful if you can just emphasize around it.
Again, a little technical. There are basically commonly three types of stones. One is calcium stones, 2 is oxalate stone, and 3 is uric acid stone. Ideally, when you have a stone, you would want to find out what it's made of. Say if it's made of uric acid, then you know what diet to use to reduce the uric acid in the diet, and also what pills to give to reduce the uric acid. Once you know that it's a calcium stone, you know what dietary changes to make. But many times you don't have that facility because we don't have the stone in our hands to examine it. Though if you can get hold of the stone, you can examine it, do a biochemical analysis and find out exactly what it's made of and tailor your diet and medications.
That's what I was about to say, because, like most of the people I've heard, they know that they have stones, but they generally don't know what type of stone it is. Yeah.
So if you don't have that, you have blanket restrictions. You have to drink at least 3 liters of water. You have to reduce salt in your diet because salt can also cause more formation of stones. You need to limit the calcium in your diet. So milk and milk products should be limited. Don't stop. Limit them. And you need to reduce oxalate in your diet. Oxalate comes from palak and tomato. And uric acid comes from cabbage, cauliflower, red meat, alcohol. So restrict all those things. So it's a blanket restriction. About the size of the stones and when to operate. If the stones are big, ultimately the bottom line or the rule of thumb is, if the stone is blocking the urinary passage, you need operation. So you have the kidney, you have the ureter, you have the bladder. So if it is in the ureter or it's in the junction of the kidney and ureter and blocking, then you should operate. If it is just in the kidney tissue and it's not causing any block, you don't need to operate. You can just do dietary change.
In spite of the size.
See, if it's really big, then you can try some lithotripsy and all, but very rarely will it be that big in the kidney tissue. Most of them, the big stones are in this junction between the kidney and the ureter. They're called staghorn stones. Usually they're infection stones. So those are the big ones. These small ones are ones in the kidney tissue, and the medium-sized ones are in the ureter. So those are the ones which you need to operate. Otherwise, the ones in the kidney, you don't. Sometimes it could happen that the one in the kidney slips and gets into the ureter. In that situation, you have to operate. So, just operating unnecessarily, because see, it's very difficult to only remove the stone, right? Say it's in the kidney, how difficult it will be. You need real precision. You will remove some kidney tissue as well. It's impossible to just remove the stone and leave it. So there will be some residual damage. And if there are many of them and you go on doing it, you're unnecessarily damaging the kidney. And as long as it's not creating a problem, why would you want to fix it? So blanket dietary restrictions, surgery only if the stone is obstructing the urinary tract.
Understood, sir. And one more question that's on everybody's mind. I mean, few people say yes, few no. And can a person survive with a single kidney? Like without any issues or, visiting frequent hospital visits? I mean, a comfortable life.
Yes. Now, I'll give you one example. Anju Bobby George. She is an athlete, long jumper. She won a bronze medal in the World Athletics Champion. I'm not talking about any local championship. I'm talking about a World Athletic Championship. She won a bronze medal in 2003. She won a gold medal in 2005. She has only one kidney. She's born with one kidney. There are many people who are born with one kidney. They live through their whole life with that one kidney. Nobody realizes it. At some point in time, they get a scan and they find that they have one kidney. But then nobody knows about it. And then it doesn't bother him at all. Like Anju Bobby George at that level, at that athletic level, with a single kidney. She also incidentally found it. She won the gold medal, and then for some reason she needed a scan. And she found, hey, I got one kidney. And what happens is that kidney hypertrophies. It becomes more potent, bigger, and takes over the function of the other kidney. So it can take up to 80%. So if you say two kidneys are 100%, one kidney is 50%. So this one kidney can go up to 80%. So it's enough to take you through the rest of your life. Same thing with kidney donation. There's a lot of fears that somebody who donates a kidney will get into trouble in future life. Now, interestingly, there have been studies done, medical studies, proper studies, where they looked at long-term survivals of donors, kidney donors, those who donated to the kidneys to their loved ones. They studied them for 20 years, past donation, and they found, interestingly, that kidney donors lived longer than people who did not donate kidneys. Those who had two kidneys, the kidney donor lived longer. Now, that doesn't mean that everybody should go around donating kidneys, but the point is, the kidney donor is evaluated from head to toe before taking the kidney. They're a proven healthy individual before the donation. Whereas all of us, general people, we don't have any evaluation, right? And we don't know, we might be having some underlying disease which will suddenly manifest in later years, and then you will die faster. Whereas the kidney donor has been proven to be normal, so they live longer. That's the reason why this particular study, this Q in the survival of kidney donors. So kidney donation also, you live with a single kidney, it doesn't do anything. Unless you're extremely unlucky, that could happen to anybody.
And so, do you think a kidney donor has to be in the pink of his or her health? But is it possible for everybody to have such perfect values, or it can be there are some criteria wherein it can be still fine here and there?
Kidney donor should be absolutely in the pink of health. We do not take kidneys from anybody who has even the slightest medical problem.
Like BP also?
Yeah. Now, certain things we can take into consideration. For example, if the BP is very well controlled with one tablet and the donor's age is 50 plus. So you don't see a 30-year-old donor who has blood pressure would straight away say no. Because he's got another 30-40 years ahead of him for the blood pressure to get worse and other organs get damaged. Whereas somebody who is 50 plus, who has very well controlled blood pressure on only one drug, we know that even in the future nothing much is going to happen if the BP is well controlled. So those people, we go ahead with the donation, and we also find out who they're donating to. For example, this 55-year-old person might be donating to the son. We need to take that into consideration because the son is on dialysis and he is sick, he's got his whole life ahead of him, he's a father, and she would want to donate to his son. I mean, there's also an emotional bond there, and we need to respect that. Of course, making sure that the donor doesn't get into any trouble in the future. So we do a whole gamut of investigations which take about a week to 10 days. We get clearances from everybody before we decide on this particular donor being fit to donate. And there are minor things that we can accept. For example, like you said, if the blood pressure is very mild, we can take. Thyroid problems, if they're very mild, we can take. So there are some situations where have been documented in our textbooks that you can accept them as donors. But there should be lifestyle modifications after. The donor should be very clear, and we have psychological evaluation and counseling before the donation to tell them that from now on, you can't burn the candle at both ends. You should make sure that you drink enough fluid, avoid unnecessary medications, don't, lead a smoking, drinking, dancing, partying lifestyle. You got to be a little careful, which in fact is for everybody. All of us need to be careful, not just the donor, but the donor has to be particularly careful.
Understood, sir. And coming back to preventive medicine, can you give an example of one of your patients, or anyone that you know who have like very well managed their issue or kidney health with this preventive medicine and early detection?
In my OPD about 3 or 4 years ago, a 50-year-old gentleman came in. He had been indulging in a lot of junk food. He had blood pressure, blood sugar. He was taking a lot of sweets, taking a lot of salt, not drinking enough water, and not exercising regularly. He had put on a lot of weight. And he came to me with a high blood pressure, high blood sugar, and a creatinine of 1.8 milligram per deciliter. The normal range is 0.5 to 1.3 milligram per deciliter for males. So this was elevated.
Elevated, yeah.
I had two options here. One is put him on pills to control the sugar, control the BP, and give something for the kidney disease, and send him off and tell him to come back and say, you got to be careful. That's it. The other option was give a trial with lifestyle modifications. So I had a discussion with him, and he was not very keen on taking medications. So I said, okay, if you promise that for the next 3 months, you're going to strictly follow the lifestyle modification that I tell you, then we can try it. So the modification that we did was cut down on his salt, cut down on his sugar, made sure he drank enough fluid, make sure he got off junk food, made sure he did exercises regularly, reduced the stress level, and lost weight. He came back to me after 3 months. His creatinine was 1. It's normal. And this is with all these modifications. He had lost weight, his blood pressure had got controlled, his sugars had got controlled. So this is possible. But then you require a lot of commitment from the patient and the doctor. Otherwise, it's very easy. The patient comes, you see this, you write off this prescription, take it, come back after 3 months. And the patient also is not counseled enough, and he doesn't do what he ideally should be doing to avoid medications. So if you have a smart, committed patient who is ready to bite the bullet and follow instructions carefully, there's a good possibility that lifestyle preventive medications or preventive treatment preventive measures, not treatment, preventive measures can help in reducing kidney dysfunction.
Sir, so what is the relationship between kidney health and overall well-being, and what advice would you give everybody, especially the young generation?
Kidneys are very versatile organs. I mean, we all think of kidneys only as an excretory organ where they take out all fluid and waste products. But there's a lot of other things that it does. It maintains the blood pressure through it maintains blood pressure. We already discussed that. Yes. It maintains the hemoglobin through erythropoietin. It keeps the bone strong through vitamin D. It helps in reproductive function. It helps in keeping the skin texture nice and smooth. It also helps in your appetite. And it has a lot of connections with other systems as well. Kidneys are preferred organs. They get 20% of the blood supply which the heart pumps out. Whatever blood the heart pumps out, 20% goes to the kidney, even though they just weigh 200 to 400 grams. On the other hand, the brain, which weighs 1 to 1.5 kgs, gets 25% of the cardiac function or the cardiac output of the blood supply. So the kidneys are favored organs. The trade-off here is because they're favored organs and they demand so much blood supply, they're very vulnerable to changes in the blood pressure and the blood flow and the oxygen that is delivered to them. So the minute something goes wrong there, goes wrong in any system, they start giving trouble. Also, research has now shown that there's a lot of crosstalk between different organs. So the kidney will talk, these are chemical crosstalks we're talking about. Kidney will talk to the heart will talk to the liver, heart will talk to kidney. And the kidney is the one organ which has maximum crosstalk with other organs. So it's favored because of more blood supply, it's vulnerable because of more blood supply, and it has a lot of crosstalk with other organs. There's a syndrome called cardiorenal syndrome, and this is something which is well established now. Any kidney disease can cause heart problem, and heart problem can cause kidney disease, and this is called cardiorenal syndrome. There are 5 different types of this. So, and this is because of the crosstalk between them. So, what I would like to tell the younger generation about, I'm going to be a little Gen Z-ish now, and give you a signature move which I thought of, which Dr. Homo Shapien and me thought of together. And this is something which I want to put into the mainstream so that more people can understand it. So, through the social media, so we can understand this and then we can apply it in our personal lives. So, it goes like this: protect your kidneys, improve your heart, save your life. Protect your kidneys, improve your heart, save your life. So this is very important. All organs are connected together, and you need to protect everything to have a better and happier life.
Overall well-being.
Yes.
So that's a very interesting concept you have come up with. I think the younger generation will definitely understand.
They will gel with this, and then we should keep doing it so that we can keep pushing it, so that more people are involved and understand this whole concept that the body is, though it's a whole, they're all different parts. It's like a family with different people. Even if one person in the family is upset, the whole disturbs everything, and this is how it is. And like I said, I know I'm a nephrologist, so I'm focusing on the kidney, but in a clinical application, when I go to the wards to see a patient, if the kidneys are functioning well, and how do I know? Simple test: serum creatinine and urine output. If the kidneys are functioning well, I know everything is going well. If the kidneys are giving problems, I know there's a problem somewhere, and then we need to find it out. So this is how I apply it clinically. And the advice to the younger generation is, you're young, yes, but then you're not invincible. Though when I was young, I thought I was invincible, but we're not invincible. Bodies are bodies, they have our systems, and then we need to be careful about it and respect it. So no burning, like I said, burning the candle at both ends, no high end lifestyles, eating all sorts of junk. I'm not saying don't eat junk, but minimize it. I mean, don't eat junk every day. Sleep properly, have a little bit of discipline. I know my dad used to keep saying discipline, discipline. It's very difficult to follow it, but unless you think about it and apply it, it's difficult to do it. But look at it from a holistic perspective, that you need to do this to live a long, happy and fulfilled life. It's not just about a long life. It's about the quality, not just about the quantity. It's about how fulfilled you are. You will have your bucket list, and you should be able to tick it off. I've done the first step in the bucket list. I've got the bucket.
So, I mean, I think we'll definitely connect to it, sir. It's very inspiring to hear as well. So, coming to the various kidney diseases that a layman would not understand, what are some general misconceptions about kidney health and kidney diseases?
We've already discussed about the water intake. We discussed about single kidney, about donors. 2 things I want to highlight here. One, there's the misconception that once somebody starts dialysis, it's going to be a lifelong process. This is not true, because you could do dialysis for a reversible cause. Now, kidney disease is divided into acute and chronic, where chronic is by definition irreversible. It's slowly progressive, and finally you reach something called end stage and you need dialysis, then there's no getting out. There's something called acute kidney disease, where, say, because of infection or a stone or dehydration or some medication, the kidney suddenly shuts down. Then if you treat the primary cause, like you remove the stone or you treat the infection, you correct the dehydration, the kidney will improve. But that improvement might take a week or 2. In that time, you might need to support the kidney with dialysis. So this misconception that once you start dialysis, you will have to continue for the rest of your life is not true. It depends on the primary cause or the type of kidney disease you have and the primary cause. Now, if I want to draw an analogy, there are some patients patients' families, when they come to us with kidney failure and we tell them you need dialysis, they say, sir, if you start dialysis now, we will have to continue for the rest of our life, so we don't want to start. We will just manage like that, don't start. Now, the analogy for there is, you will have breakfast, then you will have lunch, you will have dinner. So by your logic, if you have breakfast, you will have to have lunch, so you will not have breakfast. That's the same logic that they try for dialysis. I will do dialysis once, I will do again, so I won't do. I will have breakfast, but I have to have lunch, I won't have breakfast. So this is the example I try to use and explain to them, no, you will have to have dialysis, you might have for some more time, the kidneys will recover and you can stop. But if you don't do, he's likely to die. So that's how I swing it and explain to them. So that's one of the misconceptions. The other misconception is about transplant. There are people who believe transplant usually fails, and most people don't want to do transplant because they think anyway it's not going to work, it's going to fail. The thing is, the people who tell this to the other patients are those, we have this dialysis unit where patients come for dialysis and then they exchange all their stories. They have the support system. So there's a patient who is on dialysis, he goes, has transplant. In probably 10% of them it fails, he comes back to dialysis. And then all the people, other dialysis patients see him, oh, it failed. But they only see the one who failed. They do not see the 90% who come to the OPD with a creatinine of 1, leading a normal life without dialysis. They don't see that. So their outlook is a little skewed. So that's not true. And I'll give you an example. There is a Czechoslovakian footballer called Ivan Klasnic.
Oh.
He had 2 transplants. First one was his mother, failed. Then his father gave him a transplant. He's a footballer. He played for Euro 2000, I think it's 2008. Euro 2008. It's not any small tournament. Yeah. It's the second after the World Cup. He scored 2 goals post-transplant. So that is inspiring. You do a transplant. People say transplant is going to fail, but he went and scored 2 goals in Euro. I mean, that level of fitness he got after a transplant. So this misconception that transplant is
and people are gonna get weak after.
Exactly. I mean, you can do everything after a transplant. It's a completely new life. It's a complete cure of whatever kidney problem you have. So these are the 2 misconceptions, I think, and we've already cleared the other misconceptions.
And sir, is it true that kidneys are the first organs to shut down in a body? I mean,
yes, we already discussed that, because it's the favored organ, because it demands so much oxygen and so much blood. Whenever there's a little drop, immediately it starts giving trouble. It's one of the first things to give trouble. Yes.
Okay. Yeah, understood, sir.
So we use that as a marker. कि kidney ठीक है तो ठीक है, kidney में problem है तो there's some problem somewhere, better find out.
Yeah. And sir, since we are talking about this misconceptions and all, we have a lot of people, especially these gym junkies, who take in a lot of protein powders. So, I mean, even people do it to get results quickly in the gym. So, do you think it's safe for the kidney health?
Absolutely no. And I get a lot of youngsters when I'm working out in the gym who come to me and say, sir, do you use any protein powders? Should we be using protein powders? What do you recommend? I'm very, very clear about it. No.
Even in limited amount?
Yes. Because when you're taking more protein, see, there's no point taking limited amount. You take protein because you want to build up muscle, right? So you take lots and lots of protein. You take your normal dietary protein, plus you take these protein supplements, or whatever, whey protein, creatine, coach's formula, whatever, you take all those things. Now, when you take more protein, it goes to the kidney. The kidney cells have to work overtime to excrete that protein. They get swollen up and they can get damaged in that process. That's one problem with taking more protein, because the kidney has to process it and it can get into trouble. If you already have a very mild kidney problem, and those who are gymmers who got high muscle mass, they produce more creatine, because creatine comes from the muscle. It comes from the muscle, goes to the kidney and is excreted. So if you have very high muscle mass, your creatine values will always be slightly higher than normal, or in the upper limit of normal. So you're already on the border, you give more protein and more creatine, and that can increase your creatine, worsen your kidney function. The second problem is, and this is a rule of thumb for everything, anything that comes off a shelf is preserved, correct? Anything which is perishable is not preserved. Anything that comes off a shelf has to be preserved. It won't stay on the shelf otherwise. And what is a preservative? Salt. And though they don't mention it on the label, but there will be salt. Otherwise, how will you preserve it? So salt plus protein. And we all know what salt can do. It can increase the blood pressure. It can cause kidney dysfunction, water retention, high strokes, all those things. Salt, like I said, the 3 whites is one of those killers. So one salt load, so with taking more protein, salt loads and more protein can cause kidney damage. Protein supplements are useful only for those who are debilitated. Sick patients who are not able to eat enough protein, or their appetite is not good, those people we give protein supplements, not for normal healthy individuals. If you want to increase your protein, take natural protein. The only situation where you would take very, very high protein is if you are a professional bodybuilder and you're doing it for your profession to win tournaments or whatever. For those people, it's acceptable, but then they will have to pay for it in later life. But the normal recreational gymmers, definitely you don't require. I mean, what do you want to become? You want to definitely have a little bit of bulk and all that. But today the in thing, if I know, is being lean, right? It's not about being bulky. So why do that, and why put your body under stress and your kidneys and get into trouble? Unless you're into, like I said, professional bodybuilding. Recreational bodybuilding, no way. I'm clear about it.
Understood. So, yeah, general advice to all the people is like with the lifestyle changes and dietary management, people can definitely take care of their overall well-being along with their health. So, sir, in the long run, what advice would you give all people? Because, there are a lot of people who might not have access to modern medicine or preventive medicine. So, like you said, our body keeps giving subtle cues, but we might not be able to, recognize those. So, what's your general advice to people on maintaining their kidney health and overall well being on the World Kidney Day?
So I think we should keep it simple. Don't make it very complicated. Simple from every perspective, from diet, exercise, your lifestyle, sleep, your stress levels. All these things, keep it simple, and you don't really need to stress too much about it. So diet, make sure you drink enough fluid, make sure your salt is appropriate, avoid junk food, avoid too much oil, avoid too much red meat. Exercise, make sure, like, follow the grid which I told you, Dr. Homo Shapien time matrix, and believe your day has only 23 hours, find that 1 hour for exercise. Exercise is it has to be done. It's non-compromisable. It's a given. And keep your stress level, spend time with the family, have a good personal life. And all these things will finally add up into making you a happier, more fulfilled individual. It's about holistic happiness. I'm using this word a lot today, but yeah, it's about holistic happiness, not just about certain things here and there. Work-life health balance is what you should be targeting. And again, if you want a one-word advice, is keep it simple. Don't make it too complicated. Don't take too much advices from anybody else. Use your common sense. And that's the simplest way to go ahead with this.
And one last question, because there's a lot of talk and buzz around mental health these days, and a lot of people compared to the earlier times have stress, anxiety, depression, and a lot of other mental issues, if you might say. So, we have heard that they directly impact the heart, is what general word is. So, do you think all these medical issues, they directly impact the kidney health?
Psychologically, yes, can impact the kidney. In fact, the kidney also is useful in keeping your psychological demeanor at a good level, because it produces some hormones also which can affect your psychological approach. Nowadays, I think with all the social media and other things, all the information that is there, it's making people more anxious. And I think we should somehow limit that, because there are so many things on social media and in Google which are most of them wrong. Google tells you all the bad parts. It tells you the worst side of the spectrum, not the good.
Yeah, headache means cancer.
Yes, exactly. So this is something that we as a community should understand, and then there should be some kind of training to understand that this is not really the important thing. It's about how you take things. And like I said, keep it simple and don't complicate your life too much. Spend time with the family. Now, what I found is the biggest stress buster for all the psychological problems that you're talking about is exercise.
Oh.
That is the biggest stress buster. If you can find that, I know I'm harping on this, but I have done it in my life too, and I have made sure that if whatever problems I have, when I'm exercising, a lot of them go away. And in fact, it's scientific, because there's something called endorphins and enkephalins which are produced when you exercise. These are happy hormones, along with dopamine and serotonin and all. So these things make you happy by default. That's their job. So my advice to everybody is, okay, psychologically you have problems, exercise. And if it doesn't still help you, then you need help. You have to see a psychologist, preferably a psychologist, not a psychiatrist, because a psychiatrist would give you pills. A psychologist would give you counseling. That's the difference between the two of them. And you need counseling. See, all of us know inside what to do. It's just that we need to find ways to do it, and need somebody to guide us to the right way of doing it.
That's a really good advice, sir.
So exercise is the bottom line.
Yeah. So we'll just have a very simple yes or no question round now. Yeah. So does eating too much rice contribute to the formation of kidney stones?
No.
Can chronic dehydration increase the risk of developing kidney stones?
Yes.
Is it true that drinking excessive amounts of water can harm your kidneys?
Yes.
Is kidney disease primarily a concern for older adults?
Yes, but it can also happen younger adults. It's very democratic from an age perspective.
I understand. So do you only need to worry about your kidneys if you are experiencing pain?
No.
Can high salt intake lead to kidney problems?
Yes.
Is regular exercise beneficial for kidney health?
Absolutely, yes.
Do certain medications have the potential to harm kidney function?
Yes,
Can obesity increase the risk of kidney disease?
definitely yes.
Is it possible to reverse early stage kidney disease with lifestyle changes?
Yes.
So that's very informative, sir. Thank you so much for being on the Bizz Buzz show. It was an absolute pleasure hosting you.
Thank you very much, and you were wonderful as a host. You
Yeah,
got out
thank you
all the
so much,
answers
sir.
that I should have got out
Yeah,
with your questioning.
yeah.
Thank you very
Thank you
much.
so much, sir.